Let me show you the 5 things that break this mechanism apart. Number 1, and by far the most common, is vascular damage. High blood pressure, high cholesterol, diabetes, heart disease, many other conditions. All of them cause your arteries to get thicker, stiffer, and more narrow. So less blood gets through. And of course, when less blood gets through, those spongy tubes cannot fill with blood properly and cannot compress the veins. So the whole system fails. Here's the part that should concern you. Over the time, if this keeps on happening, the tissue inside of your penis starts to change. The smooth muscle that's supposed to relax and let the blood in begins to develop fibrosis or scar tissue. And once that happens, it becomes very difficult to reverse. Number 2 is your mental state. Performance anxiety is one of the most common causes for erectile dysfunction, especially in the younger men. And it creates a vicious cycle. You fail to get an erection once, maybe after a few drinks, maybe because you were just stressed and tired. Then the next time you will try and you're already thinking twice about it. Will it work? Is she going to notice it? Am I going to be embarrassed again? And of course, that anxiety makes it even harder to get an erection. So it fails again. I tell this to all my patients that almost everyone with erectile dysfunction has some psychological component. Even if the root cause is physical, the stress of dealing with it adds a significant mental layer on top. Number 3 are the medications that you are taking. And this one surprises a lot of men. For example, common antidepressants medications can most definitely affect your erection. So can anti-anxiety medications like diazepam, antihistamines, even something over the counter, simple like Benadryl, blood pressure medications, especially beta blockers and thiazide diuretics, metoprolol for example. The irony is that you need to treat your blood pressure to prevent the blood vessels damage, but some of these medications we use to do that makes your erection worse. If you feel that medication that you're taking affecting your erection, please talk to your physician. Don't just stop it. Often there's an alternative that don't perhaps carry the same risk. Number 4, lifestyle. And this is a big one. Smoking damages both blood vessels and nerves and can actually cause your erections to become smaller over time because it reduces the tissue elasticity. The penis cannot enlarge. The good news is that if you quit, especially while you're still young, the damage is actually reversible. Another one is an alcohol, and it's a pretty big one. A drink or two, of course, may make you relax, lower your inhibition, but heavy or chronic drinking takes in your testosterone and damaging your nervous system. It leads to what people often call whiskey dick. Long-term use makes all of this permanent. And of course, I have to mention those recreational drugs. Amphetamines double the odds of developing erectile dysfunction. And chronic cannabis use can affect the lining of your blood vessels and disturb your hormonal balance as well. Chronic pain medications use increases the odds by 8 to 10 times. Number 5. Hormones. Now, this one is important because there's a lot of misinformation about it online. Only 3 to 6% of erectile dysfunctions are purely hormonal. So when the guy thinks they just need a testosterone injection or testosterone replacement and everything will be fixed, that's almost never a full picture. It almost never happens. Low testosterone plays a role in desire, in arousal, in libido. Yeah, absolutely. But if the blood vessels or nerves are not working, more testosterone alone wouldn't solve pretty much anything. Now, that said, if you suspect your levels are low, get tested. And please also check your DHEA, your thyroid, prolactin levels while you're at it, because those can definitely be contributing factors as well. What about porn? Big question, does the porn actually causes erectile dysfunction? Now, while we do have a separate video just on that topic alone, this is an important question. I get to ask this question a lot, almost every day, and the honest answer is it's more nuanced than the internet makes it to be. Multiple studies have looked at pornography use, frequency, and erectile dysfunction, and they have not found a direct correlation. The same studies also looked at premature ejaculation and sex satisfaction and found that no clear link there either. But, and it's a big, meaningful But there are certain men who are more vulnerable. If you're already dealing with anxiety, depression, stresses, or you have some moral or religious conflicts around watching porn, then using it can amplify those issues and contribute to psychological erectile dysfunction. So porn doesn't cause erectile dysfunction in most people, but some men, particularly those already dealing with psychological factors, it can make things significantly worse. And the key, of course, is being honest with yourself about whether it's becoming a problem.